Welcome back. Today, the only level 1 trauma center in West Tennessee and the lone public hospital in Memphis is taking the next step, apparently, in plans to build a brand new facility. Regional 1 announcing the team that's been tasked with designing and constructing that multi-billion-dollar new hospital today, a plan that is not without its critics. City Councilman Dr. Jeff Warren has been among them and is here to talk about that. And Dr. Warren, always glad to have you back.
Well, it's always glad to be here.
Let's talk about that announcement today. Were you surprised at all? Because I know you've been talking with a lot of folks on the county side, other medical experts as well, a lot of folks in the community. What happened?
I think what's going on is that people were listening to what I was saying, and a lot of the community leaders, and particularly the philanthropic community, wanted them to slow down a little bit and have a discussion. And I think what this is trying to push this through without having an adequate public discussion. It could be after that discussion, this is the right thing to do. If it is the right thing to do, what's the fear factor that's there to bring it out in the public? Because if we don't get state funding and we don't have the local philanthropic community buying into this in advance, the $2 billion for the largest public infrastructure ever done in Shelby County is going to come out of county taxpayer dollars, not out of state dollars, not out of federal dollars. It's going to come out of your pocket and your property tax, which is going to go up to pay for it.
And to say the wheel tax
ain't going to cover it. They've already spent it. So the idea is, and the wheel tax is for $500 million of this $2 billion project. There's $1.5 billion left, and we still have $1.2 billion of deferred maintenance for our schools, and we also have probably $1 billion to move our jail and to upgrade our jail. And so with those things going on, rushing through with this may end up putting $200 million, $300 million in the ground on a building that never gets built.
We heard Shelby County Mayor Lee Harris today calling this a bold ambition along with a bold commitment from the county as well. What do you say to that?
I would say it would be interesting to hear from other people in the county. I think that everyone realizes we need all the functions that Region 1 does right now. Okay, and we can figure out or at least discuss, are there alternative ways to provide those functions to our community without a $2 billion price tag?
And a lot of people will be listening right now in case they have not heard this conversation before. What alternatives, though, Jeff, are you talking about out there that should at least be considered?
Well, you've got Methodist University Hospital with the new Shore building that was built 4 years ago. That building was built with the idea that if needed, a trauma center could be developed within that building. We also have a number of buildings there that are medical buildings that could probably be rehabbed to the point where we could bring in the functions of Region 1 into those buildings for far less than a $2 billion price tag. So if we're going to save that $2 billion, then we can move it forward. But we don't know we can do that until we get all the parties at the table to talk. All I've been trying to do is get people to talk, and you would not believe the pushback I've gotten. I mean, people are scared to death to get out there and have a meeting and talk with each other because, this might be a good idea. There are many people in the community that believe that I'm bringing a good solution for a really complex problem.
But is this a done deal? Do you think more conversations?
Well, it's not a done deal until it's built and funded. Right now, I don't know what the business plan for that is. We know it's to build a hospital. How's it going to make money and not cost us money every year once they build it out and we see what the price tag is on the note?
But Jeff, some would argue you build it at that location where the commercial appeal used to be, and the additional businesses around that community or around that business could expand, or around the hospital. Do you see that being beneficial?
Well, if you look at it now, you'd be expecting a lot of businesses already expanding around Regional 1. Yeah, if you look around Regional 1 and you look and see the businesses that are there, what are they?
Gotcha. One last thing I do want to ask you before we run out of time. National Guard on the way to Memphis, could be here as soon as today or at least sometime this week. Is this the right move for Memphis? How do you feel?
Well, I don't think we really have a choice. We don't have a Democratic governor who refused to accept the Guard. We have a Republican governor who agreed with the president and decided he would accept the president's request to send in National Guard. I think this is coming from the White House. However, and I think as local officials, we said we didn't ask for this, but this is legal in our state. As best I can read, if the governor asked for this, then it's a legal proposition, and we have all sworn to uphold the Constitution as local officials. So we have to work with the governor to make it work. And it's not just the Guard that's coming. I think what people need to realize, we're going to get the ATF. Mm-hmm. We're going to get, the FBI. We're going to get more help with Health and Human Services. We're going to get other things coming in.
So maybe we can find some positives out of this.
I think we're going to make this work. And I think we can turn lemons into lemonade here. We just, as a community, have to realize we have to think before we act.
We'll see what happens. Dr. Jeff Warren, always glad to have you.
Thank you, Alex.